Bismillahirrahmanirrahim. Now comes water soluble vitamins. Water soluble vitamins consist of vitamin C, B1, B2, B3, B6, B9, and B12. So, first of all, comes vitamin C, which is also called as ascorbic acid. It is required, its RDA is 40 milligrams per day, and we get it from citrus fruits, etc. So, it is basically required for the production of collagen, and collagen is basically used to form bones and to form connective tissue, and it also aids in wound healing, etc. So if there is deficiency of vitamin C, it will lead to scurvy. Is basically a condition in which we have bleeding gums and bruising on the skin, and there will be less blood cells and poor wound healing, as there is less collagen and less connective tissue production. Then comes vitamin B1, which is also called as thiamine. It is required, its RDA is 1.5 milligrams per day. It acts as a coenzyme in carbohydrate metabolism. So its deficiency leads to beriberi and Wernicke-Korsakoff. So what is basically beriberi? Beriberi is a condition in which we have weakness, pain in limbs. It is due to deficiency of vitamin B1, and we have arrhythmias and edema. Basically, it affects the heart, and it causes arrhythmias and edema, etc. There are three kinds of beriberi: dry beriberi, wet beriberi, and infantile beriberi, which occurs in infants. Then comes Wernicke-Korsakoff. Wernicke-Korsakoff occurs in alcoholic patients, and what happens in this, that there is vision changes and loss of muscle coordination and memory loss, and the person is also unable to make new memories. Then comes vitamin B2, which is riboflavin, and it is also, its RD is also 1.5 mg. It acts as coenzyme in fat and protein metabolism, and its major deficiency is glossitis. Glossitis is basically the inflammation of tongue, and cheilitis or cheilosis, which is the inflammation of lips, and dermatitis and stomatitis, etc. So basically it causes inflammation of tongue and lips. Then comes vitamin B3. Its RDA is 18 milligrams, and it basically is the cofactor in glycolysis and TCA cycle. Its deficiency causes pellagra. What is pellagra basically? Pellagra is, we should remember it by 3 Ds. 3 Ds means diarrhea, dementia, and dermatitis. So after vitamin B3 or niacin comes vitamin B6, which is pyridoxine. Its requirement is 2 milligrams per day, and it acts as a coenzyme in energy metabolism and hemoglobin formation. So it basically, its deficiency leads to altered nerve function, altered peripheral nerve function. Then comes vitamin B12, which is scopolamine. Its RDA is 1 microgram per day, and what is its function? B12's function is transport and storage of folate energy metabolism. Basically, it is required for folic acid metabolism and blood cell production and nerve formation. Its deficiency leads to pernicious anemia. Pernicious anemia is the type of anemia basically in which there is less production of red blood cells due to decrease in the intrinsic factor. Due to the decrease in intrinsic factor, there is less absorption of B12, and there is then less production of RBCs. Then comes folic acid. Folic acid is basically vitamin B9, and its RDA is 100 micrograms. It acts as a coenzyme in metabolism, and it is used in fetal neural tube formation. That is why pregnant women are given folic acid, because it forms the neural tube of the fetus. Its deficiency leads to megaloblastic anemia. Megaloblastic anemia means that the size of the RBCs is raised, is increased. This is all about water soluble vitamins.